To have a good student is a teacher's blessing. That is what a teacher really desires. To have wonderful students, dedicated and great and wonder and good, is indeed a blessing. My name is Dr. Devan, Professor, Department of ENT of the AJ Institute of Medical Sciences. And many years back, I was blessed to have a student of outstanding caliber and expertise, Dr. Vishwas. He joined for his masters and then triumphantly finished at the very near top in the university, and later on joined the department as a faculty and rose through the ranks. Now he has imbibed techniques and expertise in a variety of areas, especially in the field of sinus surgery, in which he is a grandmaster. But then there are pressing issues in the society, one of which is industrial noise. So many people are being hurt and their hearing has been affected by noise which is beyond the limit of permission, and therefore I called on him to talk about industrial noise exposure and its prevention, protection, and what can we do to rehabilitate them. Over to Dr. Vishwas, please.
So thank you so much for the wonderful introduction. I don't know if I deserve those words, but as sir said, the teacher-student relationship, I must put this on record that as sir said, having a good student is a teacher's blessing, but the reverse is also truer and much truer in a bigger sense, that a student should always get a very good teacher, because a student is just like an uncarved wood piece. So the person who carves can give it any the shape and look, and make it look exquisite. So in the same way, a teacher can actually mold a student's future career and their whole persona in general. So thank you in that regard, and thank you for having me here to discuss a few things about hearing loss and noise-induced hearing loss. Sir, noise-induced hearing loss nowadays has become an epidemic. We see a lot of noise-induced hearing loss cases in our private practice, in our hospitals, in our clinics. Now, why is this happening? A lot of industries have come up in our area, especially if you go around 50 kilometers around this city. We have mushroom-like springing of heavy industries, factories, and a lot of employment has been generated. A lot of labor has been occupied and employed by these factories. And in that regard, we get a lot of patients nowadays who come with complaints of hearing loss. And sometimes it's accidental findings. Those companies who have a proper check-in place, who subject their candidates for an yearly, annual hearing checkup and other medical checkup, we screen them and we find a few. But there are people who just walk into the clinic complaining of decreased hearing and other symptoms caused by noise-induced hearing loss, like tinnitus, which is the presence of hearing a sound when there is actually none. So that is tinnitus. A lot of people come with tinnitus and they don't know that it is actually hearing nerve damage which is causing the tinnitus. Some patients land up with vertigo, giddiness, such episodes, again which may or may be related to the hearing loss. We have a lot of patients who come up with nothing. They come up with symptoms like ear pain and prolonged exposure to loud sound. Now, why is this happening? One thing is the factories obviously have check-in place because they have to follow the regulations. They make sure that hearing loss does not happen and protective equipments are given. Hearing caps, hearing maskers, protective equipments are given to most of the employees. But an oversight, or I don't want to wear it, it is too heavy, I start sweating inside because it's very hot in the factories. Those are the simple common excuses given by most of these people when we ask if you're not using those hearing protective equipment. So these are the explanation generally the patients give. And when asked to the company, there are some representatives of the company who accompany the patient along. So they say that we make sure they put, but sometimes when there's no supervisor, they don't put, or some people generally do not want to put, and finding that kind of a combination wherein every step, every check is correctly followed is difficult sometimes. So in that regard, we get a lot of patients with the noise-induced hearing loss. In addition to it, recent what I have found in the clinical practice is we have been seeing a lot of these young students coming with hearing loss. And the common factor in them which I have found is students who are staying in the city or staying somewhere else, or traveling into the city or traveling out of the city for college purposes. So some students who go up to 1.5 hours for their engineering college or medical college or any other professional courses they are going. So they travel 1.5 hours up, 1.5 hours down. So every day 3 hours per day. And the whole 3 hours they are stuck with earphones at full volume. They don't even reduce the volume. That is, I make sure they ask this question that what volume and all that. They said no, we want full volume. So 3 hours of daily exposure to sound, noise, and at least 6 days a week, 5 days a week they go to college or these courses. They attend the courses. So they have this continuous exposure for over the period of 2-3 years. And this especially has become a major problem since COVID. Initially it started with the online classes. Then online classes, once they are over, there is OTT channels where they see series or movies, and there's music. There's so much of option in social media now, and internet being so cheap and almost free, people do not have any dearth of internet. People have enough time, so they have been using a lot of the social media sites and watching a lot of movies, hearing to a lot of music. So noise-induced hearing loss in young boys and girls who are between 16, 18, 25, we are seeing a lot of them. It's become much more of an epidemic in their age group than actual factory workers or factory laborers. So this is in the last 2 or 3 years which I have seen, and I've had this discussion with other clinicians also, and they're also agreeing to the fact that this is happening. Earlier we would see very few cases of sudden sensorineural hearing loss in young people, but now we are seeing a lot of cases, and this is not sudden. Over a period of time they gradually come up with some amount of hearing loss, tinnitus, and all these symptoms. So in that regard, again, we try to advise these people who come, but I think there should be more of social awareness program in place, wherein especially we target this population and tell them that what kind of damage they are doing to their ear. Hearing is very important, just like sight. Without sight, imagine a person who has seen the world, suddenly you close your eyes and say from today you cannot see. It's going to be very difficult. Similarly with hearing is something which we take for granted. The senses which we have been blessed with, we take for granted. We don't really know its importance till we lose it. So sometimes if vision, hearing, all that which could be avoided, so damage could be avoided completely by you either reducing the volume at intensity at which you are listening to, reducing the amount of hours per day you are listening to, or using other alternative measures, like instead of using a high blasting earphone, if you can use a headphone or a bone anchored earphone. So there are many options which can reduce the damage by slight alteration of the techniques which you are using to watch or use this multimedia equipment. So these are the basic things which we need to say. Factory and industrial workers, the awareness programs have been going on for ages together, but again, what is more important is implementation. We should stress on implementation of these things. Maybe sudden unverified or sudden inspections of the factory places, wherein you find some employees not using a proper equipment. Maybe the factory can be penalized, or have certain checks in place wherein somebody else is also held responsible or liable to what is happening. So in that regard, I would say that noise-induced hearing loss, we require to do a lot of work among not just among the factory or the industrial setup, also among the general public, especially younger population who have been using a lot of earpods and speakers and earphones, etc. So that is very important. Now the treatment of noise-induced hearing loss can always be done. See, it's not difficult, but say noise-induced hearing loss, which is say continuous 85 decibel, the definition says that 85 decibel of exposure for 8 hours can cause enough damage in the hearing now. So if this is happening, normal conversation usually happens between 45 to 60 decibels. So at 85 decibels, that is when you scream. So for continuous 8 hours, if you're listening to something which is at the level of the scream of a human being, there will be some amount of hearing nerve damage. So if that happens, what can we do? There are certain medicines which increase the blood supply to the nerve and all that, which we can try. It can be tried only if the hearing loss is about 10 to 15 or 20 decibels. That might give an improvement of 5-10 decibels and the patient might feel better with the hearing. But when we do an audiology test to check how much of the hearing loss is occurred, and the hearing loss shows say around 40 decibels or 45-50 decibels, then there is not much which the medicines will do, because even an improvement of 5 to 10 decibels is not going to make much of a difference to the patient. If you see the percentage wise, it will be hardly 20% of improvement, whereas if it's a 20 decibel loss, if 10 decibel improves, it's a 50% improvement, so the patient feels much better. So we can always advocate hearing aids in these patients for better hearing. But again, hearing aids in these patients will be taken sportingly, or will be taken voluntarily, say if the person is say in a little higher age group, say 40, 45, 50, patient is easily, or maybe we can convince them for a hearing aid, because they will not mind putting a hearing aid. But the same thing is not much of an option in a younger fellow. We don't, if you consider yourself at the age of 20 or 25, you don't want to be stuck with an hearing aid, because it's not just physical thing which we are wearing, with a lot of social stigma, a lot of mental harassment kind of thing you go through. Because see, it's not that done with a bad intent maybe, but some friend of yours will make a comment, what is this, have you become 50 now, have you become old, why are you putting this and all that. So such kind of insults, people are not not everybody takes it so easily. We have a lot of mental issues in this younger age group, adolescent age group, and younger children. So we have to be very careful when we advocate something, and if they have to be forced to use something, we have to take them into confidence. We have to build that relation with them and try and make them understand that it's absolutely necessary for their hearing nerve to not to get damaged further, and for them to have better quality of life. Even when they're not hearing, they'll be made fun of, that they'll be called names, that he's the fellow is deaf, or fellow is not hearing properly and all that. So for having a better quality of life, the need might be there, and we have to take the person into confidence. Even if they're young, we have to take them into confidence. We have to take their parents into confidence. We have to tell them, see, this is absolutely necessary and very important. So if you use this now, maybe you will have no further requirement, as the age progresses. So it becomes responsibility of the treating physician, treating doctor also, to explain in a way that the patient party, everybody understands the need and does the utilization of the same available method, so that they will be having a good quality of life. So that is the treatment part of noise-induced hearing loss. There's no much surgical intervention which we can do for this condition, because noise-induced hearing loss, which literally means the hearing nerve is damaged. So neurologically, we cannot, there is no surgery which we can, probably take a nerve and put a graft or something. So those such things don't exist. So there is no option of surgery in noise-induced hearing loss. There are some implants and all that, but not necessary for NIHL. Hearing aids are more than sufficient. So this is about noise-induced hearing loss. We started from the industrial aspect of it, and what is happening more practically in our society. The exposure to sound is not just in heavy industries. It could be from a small 2-inch earpods which we use very commonly. If you actually take a ride round the city, you will see at least 40% to 50% of them with a hearing earpod roaming around. Either they're walking, either they're jogging, or if they're just going routinely to their work. So they'll all be using this. So that in that aspect, it has become kind of an epidemic now. So that is my take over noise-induced hearing loss and its aspects.
Absolutely fantastic. Dr. Vishwas, you have covered a panorama of topics related to noise-induced hearing loss and opened a window to the mind of discerning youngsters who, on the anvil of a journey, must be cautious. So, two things I will tell. Fear is the key, and prevention is better than cure. What does that mean? Fear is the key. So, therefore, when I tell a parent, if you don't caution a child, they're going to be deaf for life and they're going to be discarded from society. So, maybe in the orientation of all schools and colleges, when they come in, the parents' meeting, we must make it very clear. Listen, there is a tendency for your ward to continue use here and high definition, and then if they do that, they're going to be deaf. You better warn them and caution them, and then later on, as the years in their formative years advance, they should be cautioned. If you're consistently going to have this habit, you're going to be deaf, and you better be careful. So that fear brings in them a certain fear that, oh my God, I better be careful, because once you're deaf and your nerve is damaged, it is a point of no return. You have to rely on the accessories that you so nicely highlighted. An opener for me was when you mentioned about bone hearing aid, that bone hearing devices, that's a bit more safer than the actual headphone that you use. But you have extensively covered this huge topic, and I hope all parents, all students, all teachers listen to this eye-opening lecture by Dr. Vishwas, who not only in a variety of ways, in a variety of areas, head and neck, ENT head and neck is a vast area. In fact, one of the largest subjects in the management of the human body, and here he has excelled in various expertises. But here I am so touched by him acceding to my request, coming here this morning and sharing his wonderful wisdom with us. Now, having taken his time off and coming and sharing his large amount of knowledge and wisdom with us, I am so indebted to Dr. Vishwas, and I call upon our Executive Director, Mr. Brijesh, to please hand over a certificate of appreciation to Dr. Vishwas. Thank you so very much.
Thank you so much again for calling me.
Thank you.